Good morning, Mr. Burke. I'm so glad you're going to get to go home today. So, during your stay here, we discovered that you had a transient ischemic attack, or something called a TIA. So, the way these work is through temporary blockages in the blood vessels that run through your body, and then depending on where this blockage occurs, the symptoms will vary. So, they can form in any vessel throughout your body and eventually move throughout the blood and can become stuck in a major vessel that leads to the brain. And if it doesn't move, which in your case it did, thankfully, it can lead to your brain cells starting to die or something called a stroke. So once these cells once they start dying, it can lead to many different kind of things like dysphagia or trouble swallowing and trouble eating, that kind of thing, or weakness in your left side, that kind of thing, or right side. They don't come back. So the doctor prescribes some medicine to help prevent these clots from forming so that you won't have another blood clot to form. So I know you're probably curious as to why you got this condition. Unfortunately, we don't know the exact reason why you have it, but I know you said that you have high blood pressure and that you smoke cigarettes. So this puts you at a higher risk for having a stroke. And also people that are African American and over the age of 55 have a higher risk for having a stroke. So we can help come up with different ways to help stop smoking. There's a million ways for that. And there's a lot of medications that we can try to help lower your blood pressure. Some of them are free, so just let us know when you're ready and what you want to try. So you've been prescribed ticagrelor to prevent the formation of these clots. So the way it works is to stop something called ADP. So it normally helps to tell platelets, which is something that clumps the platelets together. And it causes a clot to help seal a vessel off when you have an injury that causes bleeding. So, however, with your conditions, the platelets are clumping together too much and too frequently, and it's causing blockages to occur. So, this medication basically tells ADP to stop doing that. So, this type of medication does have a few side effects that we do want you to watch out for while you're taking it, especially for the first few weeks, just to make sure we don't have any side effects. So the main thing we want you to watch out for is any bleeding, because as I said before, this medication can stop you from clotting, and it allows more bleeding to happen than normal. So just be sure to watch out for any big bruises, any kind of cut that won't stop bleeding. And also with this medication, it can increase the bleeding if you take more than 100 milligrams of aspirin. So just watch any kind of prescriptions that have too much of aspirin in there. And then just to clarify, you don't have any stomach ulcers or any kind of intestinal bleeding issues, right? Okay, that's good. Just wanted to double check because this type of medication, as I said, can stops blood clots. So if you have any kind of bleeding risk in your stomach or intestines or anything, it won't stop that, so you keep bleeding. So another two things to watch out for is flu-like symptoms and chest pain. So if you have any trouble with a lot of nausea, a lot of diarrhea, a lot of chest pain, we can try to change your medication to help prevent the symptoms from happening. So we're going to have you come back in a couple of weeks to make sure you're not having any bleeding issues, any of the issues I talked about before with the symptoms, and then also to make sure that the medication's working. So, as I said before, the TIAs have an increased risk of a stroke. So if you have any of the symptoms, no matter how big or small, be sure you don't hesitate to call 911 and go to the hospital. Also, make sure that you work on your smoking habits and taking your medication for high blood pressure, because these two things together are really bad when you have blood clots forming in your body. And we want you to stay healthy. So I know that was a lot of information at one time, but can you tell me what you're going to do when you get home? Yes, perfect. Okay, thank you.